All right, let's dive into some really fascinating research. This could be huge for millions of people. People dealing with rotator cuff injuries.
Yeah.
You know, those persistent shoulder aches that just make even simple tasks like reaching for a coffee cup a real pain.
Yeah.
We're talking about a potential non-surgical solution.
Yeah.
It could revolutionize how we treat these incredibly common injuries.
Yeah. Rotator cuff tears, it's a big deal. It affects over 2 million Americans every year. And the current gold standard treatment, surgery, comes with a whole bunch of downsides, like a long recovery period, potential complications. So, yeah, the idea of a less invasive alternative, well, it's generating a lot of excitement in the medical community. It's definitely a hot topic.
Yeah.
For good reason.
Okay, so let's unpack this a little bit. We're talking about stem cells, right?
We are.
Can you kind of break down for us what's so groundbreaking about this approach?
Sure. So this research is focusing on a specific type of stem cell, found in something called microfat. So basically, it's a refined form of your body's own fat tissue. These cells are being used to treat partial thickness rotator cuff tears, which are tears that don't completely sever the tendon. Think of it like fraying a rope instead of cutting it clean through.
Ah, okay. That's a great way to visualize it.
Yeah.
So they inject these stem cells directly into the injured area, almost like patching up that fraying rope.
Exactly. And the beauty of it is that it's minimally invasive. No major incisions, no general anesthesia. Patients could potentially walk out of the procedure and continue their day with, minimal downtime.
Wow, that's a world of difference compared to surgery.
Right.
I'm guessing it's not just as simple as injecting some stem cells and calling it a day, though, right?
Right.
There must be tons of research and testing going on.
Absolutely. This research is being spearheaded by a partnership between Regenerative Orthopedics and Sports Medicine, or ROSM, and the Orthobiologics Research Initiative Inc., known as ORI. And they're conducting a 2-year randomized placebo-controlled trial, which is the gold standard when it comes to medical research, to see just how effective this treatment is. And it's set to wrap up in December 2026.
Okay, so they're taking a very rigorous scientific approach to making sure this treatment is both safe and effective. And I read that they even received a grant from the Maryland Stem Cell Research Fund to support this work. That speaks volumes about the potential impact, wouldn't you say?
It does, absolutely. This grant highlights the significance of this research and its potential to change the lives of so many people, countless people suffering from rotator cuff tears. It's a really exciting development.
Yeah. Now, earlier you mentioned that this treatment could be a game changer.
Right.
Can you maybe paint a picture for our listener of what that actually looks like? What kind of benefits are we talking about here?
Sure. Imagine a world where people with rotator cuff tears don't have to endure months of painful rehabilitation after surgery. This stem cell treatment could potentially speed up healing time dramatically, getting people back to their daily activities faster.
Okay, so less pain, faster recovery, and potentially avoiding surgery altogether.
Yeah.
Those are some pretty compelling benefits.
Mm-hmm.
But I'm curious, what makes microfat stem cells so special for this type of injury? Why not use other types of stem cells?
That's a great question. So what's fascinating about microfat stem cells is that they're particularly adept at differentiating into the types of cells that make up tendons and ligaments. So they're like tiny construction workers that can go in and help rebuild the damaged tissue.
Okay, so they're like specialized stem cells.
Yeah.
Perfectly suited for this job. It's incredible how our bodies have these mechanisms for self-repair. I'm guessing that this research could have implications beyond just rotator cuff tears, right?
Yeah, you're absolutely right. The potential applications of this research are vast. We're talking about any condition where there's damage to tendons, ligaments, cartilage, or bone.
So athletes with sports-related injuries, people with osteoarthritis, even those who have suffered spinal cord injuries, they could all potentially benefit from this research.
Precisely. It's a rapidly growing area of research, and the possibilities are really inspiring.
This is all sounding pretty incredible, but I'm sure some of our listeners might be wondering, is this treatment only for certain types of rotator cuff tears?
Yeah.
You mentioned partial thickness tears earlier. Can you elaborate on that a little bit?
Sure. So you see, the rotator cuff is made up of a group of 4 muscles, and they're tendons. That helps stabilize the shoulder joint. A partial thickness tear means that one or more of these tendons is damaged, but not completely severed. Think of it, again, like a rope with some frayed strands, but it's still holding together.
Ah, okay, that makes perfect sense. So this treatment is focused on repairing those frayed strands before they become a complete tear.
Exactly. It's a preventative measure, aiming to stop the damage from progressing and restore full function to the shoulder.
That's such a proactive approach to treating these injuries. And from what you've described, This research seems to be holding a lot of promise.
It is. It's a great example of what's possible in the field of regenerative medicine, which focuses on harnessing the body's own healing power to repair damaged tissues and restore function. We're moving away from simply managing symptoms and towards truly addressing the underlying cause of these conditions.
It's almost like science fiction becoming reality.
I know,
This
right?
idea of regenerating damaged tissues sounds like something straight out of a futuristic movie.
It does, but it's becoming increasingly possible thanks to groundbreaking research like this.
So let's talk about the trial itself a little bit. Can you give us some more insight into what's happening behind the scenes,
Yeah.
how many people are involved, and what are the researchers looking for?
Well, this particular trial is focusing on underserved populations in Maryland, which is an important step towards ensuring equitable access to this potentially life-changing treatment.
Yeah, that's a crucial point. Everyone deserves access to cutting-edge healthcare, regardless of their background or socioeconomic status. It's great to see that this study is prioritizing inclusivity.
Absolutely. And ROSM is playing a key role in this by serving as a physician partner in the trial. They're working to ensure that the research is conducted ethically and that the results are disseminated widely.
That's fantastic. So what are the researchers specifically looking for in this trial? What would indicate success?
They're primarily measuring things like pain reduction, improvement in shoulder function, and the overall quality of life of the participants. They'll be comparing the results of those who received the stem cell treatment to those who received a placebo to determine if there's a statistically significant difference.
So it's a head-to-head comparison to see if the stem cell treatment truly makes a difference. What happens if the results are positive? What's the next step?
If this treatment proves to be as successful as researchers hope, the next step would be to seek approval from the FDA to make it more widely available to patients. It's a rigorous process, but it's essential to ensure the safety and efficacy of any new medical treatment.
That makes sense. It's all about proceeding with caution and letting the science guide the way. This research has the potential to revolutionize how we approach orthopedic care in general.
It really does paint an optimistic picture for the future of orthopedics.
And it's not just about the physical healing either. Think about the emotional and psychological toll that chronic pain and disability can take on individuals. This research could offer a glimmer of hope to people who have been struggling for years, maybe even decades, with these conditions.
You're absolutely right. The impact on quality of life is immense. This could mean people returning to the activities they love, regaining their independence, and simply living without constant pain.
It's all about empowering people to live their lives to the fullest, right?
Precisely.
Right.
And that's what makes this research so compelling. It's not just about fixing a physical problem, it's about restoring a sense of wholeness and well-being.
All right. So we've been talking about all the amazing potential benefits of this research, but let's be realistic for a moment. There are always challenges and uncertainties when it comes to cutting-edge science. What are some of the hurdles that this research team might face?
That's an important question. One of the biggest challenges in regenerative medicine is ensuring the safety and efficacy of these treatments. While early results are promising, we need rigorous clinical trials, like the one being conducted by ROSM and ORII, to confirm that these therapies are both effective and safe in the long term. It's all about proceeding with caution and letting the science guide the way.
Yeah. And I imagine another challenge is scaling up production and making these treatments widely accessible,
Right.
if they do prove successful. Right now, these therapies are often considered experimental and may not be covered by insurance. We need to work towards making them more affordable and available to everyone who could benefit.
Absolutely. It's a complex issue that involves collaboration between researchers, clinicians, policymakers, and insurance providers.
So it sounds like there's a lot of work to be done, but the potential rewards are enormous.
That's a great way to put it. We're at the frontier of a new era in medicine. And while there will undoubtedly be challenges along the way, the possibilities are truly inspiring. It's true. It really is a lot of ground to cover before this becomes, a standard treatment. But the progress is remarkable.
It really is. Now, something I found really fascinating about this particular study is its focus on underserved populations. Why is that such a crucial element in this research?
Well, historically, there's been a disparity in access to healthcare, particularly for certain communities, often due to socioeconomic factors or geographic location. So by prioritizing enrollment from these underserved populations, this study takes a really proactive step towards addressing those inequities.
So it's almost like they're trying to ensure that everybody benefits from these advancements, not just a select few.
Precisely. It's about promoting health equity and ensuring that everybody has a fair shot at receiving these potentially life-changing treatments.
Yeah, it's heartwarming to see that kind of commitment to inclusivity. Now, if I'm someone listening and I've been struggling with a nagging rotator cuff injury, what should I take away from all this? Is there hope on the horizon?
Absolutely. This research offers, a real reason to be optimistic. While we're still a few years away from this treatment potentially becoming widely available, the fact that it's showing such promise in clinical trials is a huge step forward.
So don't lose hope. There could be a non-surgical solution out there on the horizon for you.
Exactly. And in the meantime, it's crucial to consult with a qualified healthcare professional, discuss your treatment options, and see if you might be eligible to participate in this or other similar trials.
Yeah, that's great advice. Knowledge is power, right?
Absolutely.
The more informed you are, the better equipped you'll be to make decisions about your health.
I completely agree. And don't be afraid to ask questions and advocate for yourself. You have the right to be an active participant in your own care.
Okay, so this is where it gets really interesting. Let's say for a moment that this treatment proves to be as successful as researchers hope.
Right?
What kind of ripple effects could we see in the world of orthopedics?
Well, for starters, it could dramatically reduce the number of rotator cuff surgeries performed every year, leading to fewer complications, faster recovery times, and lower healthcare costs overall.
Wow, that's a massive impact right there. Not just for the individuals, but for the entire healthcare system.
Precisely. It's not just about treating the individual patient. It's about potentially changing the way we approach orthopedic care on a much broader scale. Instead of jumping straight to surgery, we might start by exploring these regenerative therapies as a first-line treatment option for a whole range of conditions.
So a more conservative, less invasive approach to treating these kinds of injuries?
Exactly.
That would be a paradigm shift.
It would. This research could be the catalyst for that shift. And it's not just limited to rotator cuff tears. Think about the potential impact on other conditions that affect tendons, ligaments, cartilage, or bone.
So this could be a game changer for athletes. Athletes with, like, sports-related injuries.
Absolutely.
I'm thinking like tennis elbow, ACL tears, things like that.
Absolutely. This could revolutionize sports medicine and help athletes recover faster and more effectively. And let's not forget about osteoarthritis,
Oh, right.
which affects millions of people worldwide.
Right, the wear and tear on the joints.
Mhm.
Could this stem cell treatment potentially help to repair that damage and alleviate the pain associated with osteoarthritis?
That's a major focus of research in regenerative medicine right now. The goal is to use these stem cells to regenerate that damaged cartilage and slow down the progression of the disease, offering relief to those suffering from this debilitating condition.
And what about spinal cord injuries? I know there's a lot of groundbreaking research happening in that area as well.
You're right. Spinal cord injuries are incredibly complex, but researchers are exploring the potential of stem cells to repair damaged nerves and potentially even restore function.
It's mind-blowing to think about the possibilities.
Down.
It feels like we're on the cusp of a medical revolution.
We are, and it's important to remember that this research is still in its early stages, but the progress we're seeing is truly remarkable.
It's inspiring to witness the dedication and ingenuity
Yeah.
of these researchers
Yeah.
who are pushing the boundaries of what's possible
Rah.
in medicine. And it all starts with studies, like the one being conducted by ROSM and RRI. They're paving the way for a future where regenerative medicine could transform the way we treat a wide range of conditions, improving the lives of countless individuals.
I couldn't agree more. Their work is laying the foundation for a brighter future in orthopedics. It's an exciting time to be following these developments.
Now, for those listening who are like really eager to stay up to date on this research, where can they go to learn more? Is there a way for them to get involved and support these efforts?
ROSM's website is a really excellent resource. They have detailed information about the study, their mission, and ways to contribute to their groundbreaking work.
Perfect. We'll make sure to include that link in our show notes for everyone to check out.
Wonderful. And I would also encourage your listeners to explore the wider world of regenerative medicine. There are countless fascinating breakthroughs happening as we speak. It's a constantly evolving field that holds immense promise for the future of medicine.
It's like a whole new world of possibilities is opening up before our eyes.
Absolutely. And who knows what incredible advancements await us just around the corner.
Well, that's the beauty of science, isn't it? It's all about pushing the boundaries of what's possible and discovering new ways to improve human health and well-being.
You said it. It's a journey of constant discovery. And it's a privilege to witness these incredible strides being made in medicine.
Now, before we wrap up this deep dive, I
Right.
want to bring it back to our listener and highlight a few key takeaways.
Mm.
What would you say are the most important things for them to remember about this research?
First and foremost, there's, real hope on the horizon for those suffering from rotator cuff tears. This stem cell research has the potential to revolutionize the way we treat these injuries, offering a less invasive, faster, and potentially more effective alternative to traditional surgery.
It's about harnessing the body's own healing power,
Yes.
isn't it? Empowering the body to, repair itself.
Precisely. It's
Cool.
a completely different approach to healing, one that focuses on regeneration rather than just masking the symptoms. And the exciting thing is that this research could have implications far beyond just rotator cuff tears. It could transform how we approach a wide range of orthopedic conditions, from sports injuries to osteoarthritis.
Yeah, and equally important is the focus on making these
Yeah.
cutting-edge treatments accessible to everyone.
Right.
The study's commitment to including underserved populations really sends a powerful message about health equity and ensures that these advancements benefit all members of our community.
It does. It's a testament to the researchers' dedication to improving the lives of as many people as possible, regardless of their background or socioeconomic status.
It's truly inspiring. And now, to leave our listener with a thought-provoking question. If this stem cell treatment proves successful for rotator cuff tears, how might it change the future of orthopedic care? Not just for this specific condition, but for other conditions as well. What kind of world could we create if this technology becomes widely available?
That's a fantastic question. Imagine a world where surgeries become less frequent, recovery times are drastically reduced, and people can return to their active lifestyles sooner. We could see a significant reduction in chronic pain and disability, leading to an overall improvement in quality of life for millions of people worldwide. It's an exciting prospect, and it's a future worth striving for.
Absolutely. And for our listeners who are feeling inspired and want to learn more about this research and how to support these efforts, be sure to visit rosm.org. You'll find all the details there.
I highly recommend checking it out. It's a chance to be part of something truly groundbreaking and to contribute to a future where regenerative medicine becomes a cornerstone of orthopedic care.
It really does. It feels like we're on the edge of a really big breakthrough in orthopedics. As you said, it's a journey of discovery.
A journey of discovery it is. And it's not just researchers. Researchers who are making these discoveries, patients are playing an active role too.
Oh, yeah.
By participating in these clinical trials, they're contributing to the advancement of this field.
That's so true. They're the pioneers,
Yeah.
helping to pave the way for these new and innovative treatments. And speaking of patients, I have to ask, are there any stories that stand out to you from this trial? Anything that really illustrates the impact this research is having on people's lives?
I can't share specific details to protect patient confidentiality, but I can tell you that witnessing the positive transformations in individuals who have participated in this trial, it's been incredibly rewarding to see their pain diminish, their mobility improve, and their overall quality of life increase. It's a really powerful testament to the potential of this treatment.
Right.
It reminds us why we do what we do.
Yeah, those stories are so important. They remind us that behind all the science and the data, there are real people whose lives are being touched by this research.
Yeah.
People who are regaining their independence, their ability to enjoy the simple things in life, maybe even returning to the activities that they love.
Right. Yeah.
That's what makes this work so meaningful.
Absolutely. And it's not just about physical healing. It's about restoring hope and empowering people to live their lives
Yeah.
to the fullest.
I love that. So as we're kind of wrapping up this deep dive here,
Right.
I want to leave our listener with a final thought. We've talked a lot about the exciting potential of this stem cell treatment for rotator cuff tears. But let's take it a step further. Imagine a world where regenerative medicine becomes the norm in orthopedic care.
Right.
What do you think that would look like? What kind of possibilities would it open up?
What a thought-provoking question. I believe that, widespread adoption of regenerative medicine in orthopedics could really usher in an era of personalized, proactive, and preventative care. Imagine a future where we can detect joint damage early on and intervene with these regenerative therapies before the condition progresses, and potentially avoid the need for surgery altogether.
That's incredible. It would be like shifting from a reactive approach, where we're treating problems after they arise, to like a proactive approach, where we're focusing on maintaining and restoring joint health throughout our lifespan.
Exactly. It would be a paradigm shift in how we view musculoskeletal health, moving away
Yeah.
from simply managing pain towards promoting long-term well-being. We could potentially live longer, healthier, and more active lives, free from the limitations of joint pain and degeneration.
It's a truly inspiring vision
Yeah.
of the future, and one that feels within reach, thanks to the incredible work being done by researchers like yourself. Thank you for joining us today and sharing your expertise on this fascinating topic. It's been an enlightening conversation.
Thank you so much for having me. It's been a pleasure discussing this groundbreaking research with you and your listeners.
And to our listeners, thank you for joining us on this deep dive. We hope you found this exploration of stem cell research as fascinating as we did. If you'd like to learn more about this particular study and the organization leading the charge, be sure to visit rosnism.org. Who knows? You might even be inspired to contribute to their efforts and help bring this revolutionary treatment to the world. Until next time, keep exploring, keep learning, and keep diving deep.